Sir Richard, we're talking about malaria today, which, as you know, is a preventable, treatable disease. But in 2010, it killed some 655,000 people. What kind of burden does this disease pose to people and countries around the world?
Well, it's a very large burden, and actually there are some rival estimates that show that it might have killed well over 1 million people in 2010. We're not sure about the actual number, but it's far too many people die of malaria still in the world today, and they're mainly children, and they're mainly African children. So it remains a massive burden. It's across the tropics, basically, and it's much worse in Africa than it is in other parts of the world.
But we've made substantial progress over the last decade. Can you tell me what has caused that progress? What has led to those developments?
Well, we've made huge progress, actually. In the last 100 years, 100 countries, half of all the countries in the world, have got rid of it completely. That leaves the other 100 countries in the world that still have it. And in the past decade, that 100 countries that still have malaria have made great progress. They've brought it down by 50%, by more than 50% in some countries. And there are various reasons for that. One is money, lots and lots of additional investment, and the other is new technology.
What stands in the way of a world without malaria? What are the big challenges that remain?
Well, we're driving it down, and there is now a widespread belief in eventual malaria eradication. No more human malaria on the planet. My hunch is 2050, 2060, so I won't see it, but the students that I teach at UCSF today will see it in their professional lifetime. And the journey from here today with 100 malarious countries to no malaria on the planet is a long and winding road. The progress is good. It's really about two things. Firstly, very aggressive and vigorous application of the tools we have today, combined with inventing new and better tools, the research enterprise, and bringing those rapidly into the programs on a large scale.
As we turn back to the U.S., what would you advise for the next U.S. administration, the next Congress? How can they help develop some of these new tools and implement the tools we already have?
Well, the US has made a huge contribution in the last decade. So the success of the last decade is partly because of the efforts of the United States. No question about that. A very significant contribution. Two dimensions to that, once again. One is the money. The US is the largest contributor to the Global Fund to fight AIDS, TB, and malaria. And the Global Fund is the largest international investor in malaria. The US is the largest contributor to that Global Fund. And the Global Fund is the largest international investor in the fight against malaria. So that's part of the US financial contribution. The other part is the extremely impressive and very well led President's Malaria Initiative, which was started by President Bush and continued vigorously and with full support by President Obama. And that program has also made a major contribution. So that's part of the US contribution. The other part of the US contribution is the research side. We need new and better drugs. We need the first vaccine, which we'll have very soon, and then we need a second vaccine and a third vaccine and a fourth vaccine. We need new insecticides. We need all kinds of new tools. And the US is a research powerhouse, and working with European research institutions and researchers in other parts of the world, the US continues to make a great contribution on the research side.
Thank you for your time today, Sir Richard.
Great pleasure.